So the paper I'm talking about is called Augmenting State Capacity for Child Development that was recently published in the Journal of Political Economy. So this study is situated in the ICDS program, which is India's Integrated Child Development Services. And it's the world's largest early childhood program that caters to over 35 million children of age 3 to 6 and another 45 million children aged 0 to 3. Okay, so put together, this is 80 million children. But despite the importance of the ICDS system, it's relatively understaffed and under-resourced. So the main question we're asking in this project is very, very simple, which is the government has limited budgets, and how should we be optimally spending that money in the ICDS system to improve child development outcomes? And so what we study a series of interventions, and the interventions are motivated by where does the budget go. Okay, so most of the budgets go to staff and to feeding programs, and within staff, most of it goes to salaries. Okay, and so what we study the impact of putting an extra worker on a half-day shift to focus on preschool education, and that frees up the time of the existing worker to also focus on health. And then we compare the effectiveness to other ideas, including unconditional pay increases for the existing workers. And the main results, and I think what's important about the study, even before we get to results, is to highlight that this was a large-scale randomized evaluation, okay? So, which is considered the gold standard with regard to evidence, because we worked in partnership with the Indian state government of Tamil Nadu across 4 districts and 320 such Anganwadi centers, and randomly selected half of them to receive an extra preschool educator for about a half-day shift, okay? And we followed the kids for about 18 months, and the results were really quite striking. Now, you found large, significant impacts on early childhood learning outcomes. And we also, in fact, surprisingly, found a meaningful impact on reducing child malnutrition, which was almost certainly coming from the fact that you freed up the time of the existing workers to spend more time on health. And so, in addition to finding those effects, we also measure time use within the centers. And so we have a sense of the mechanisms. And you can see that this literally doubled the amount of instructional time spent on preschool. Okay, so that's good news number 1, which is that the effects were large, positive, and meaningful. Really cost-effective, low-hanging fruit that would improve early education, improve malnutrition, and create 1 million jobs for women, and also improve women's empowerment and potentially labor force participation. Because if you now have a more reliable ICDS system, that becomes a more reliable source of childcare that could free up maternal time and female labor force participation.